Hello, everyone, and welcome to this edition of Let's Talk, presented by the Visiting Nurse and Hospice for Vermont and New Hampshire. I'm your host, Anthony Knox, and unlike other Let's Talk presentations that I've done, it's just going to be me today talking about how to be successful with getting home health services set up for yourself or a loved one that you care for. Before we get going, please, take a minute, visit our website, vnhcare.org. It'll give you all kinds of information regarding our services and how to get things set up. In addition to that, please don't hesitate to follow us on all of our social medias. In particular, we're on Facebook and Instagram. You can also find us on LinkedIn if you so choose. So I'm just going to dive right in today into the presentation. So again, how to be successful with home health services from the Visiting Nurse and Hospice. This presentation, for anybody who attended, I had done over at the Thompson Senior Center last week, and so I'm hoping that more people will have the opportunity to watch this presentation at their leisure. So what are home health services? So, that's obviously one of the biggest questions that people have. Home health services are skilled services within a person's home to be able to help them in the event that they've had some sort of an injury, an illness, recently had surgery, or have complications related to a chronic condition. So as we will find as we go through this presentation, it's not specifically based on being hospitalized. It could just be based on a chronic condition that you have that you need additional support within your home. And to help with those injuries or conditions, and to help a patient get back to a baseline or to a non-taxing effort, which for definition, a taxing effort just means that it's challenging for an individual to get in and out of their home. Not that they are completely homebound, but our services are to try to help ensure that they have the ability to get in and out of the home much more easily. And we do that through skilled nursing, physical therapy, occupational therapy, speech therapy, as well as some personal care assistance. And the goal of the home health services are to supplement the supports that's provided by your primary care team, which can include your primary care provider. It can include any specialist that you would see. Our supports are just a supplement to that to, again, help you get back to baseline so that way you can get back to seeing the providers that you're used to seeing. And again, these services are just short-term. It's not intended to be a long-term service for an individual. We do have individuals that after one visit, they're all set and they don't need anybody else to come in, as evidenced by the conversation that I had with Dr. Robert Welch a couple weeks ago, that you can also find on our YouTube page, where he talks about his experience. Versus we have individuals who receive our home supports for a much longer period of time. Generally, the average is about 34 days from the time that we start providing services until we close you out of the system for that period of service. So, but again, it's all patient specific and based on the needs of the individual. And traditionally, there are going to be three situations in which home health services will be referred to the visiting nurse and hospice. The most regular situation is that an individual is going in for surgery for some sort of medical condition. It could be a wide variety of things. It doesn't necessarily have to be related to mobility. It can be related to another condition. And once the person is going to be discharged from the hospital, they would have those services set up. But in a lot of situations as well, the individual has a medical emergency and just needs to go to the hospital, and it ends up becoming a bigger thing, whether it's an inpatient stay, whether it's surgery, whether it's just anything along those lines of some medical emergency, and our services could be a benefit from there. And then in addition to that, I had already mentioned it could be related to some sort of chronic condition that you have, and based on your visit with your primary care provider or another specialist, they determine that our services may be beneficial to you, and a referral can be put in to the VNH. So, like I had said, in most situations, an individual has a planned admission to the hospital, and prior to being admitted into the hospital, hopefully you're having a conversation with your primary care provider or the provider that is going to be doing the procedure. And you should be discussing what to expect, before, during, and after the procedure. That's just very good to take that time and have those conversations with the doctor. But a big part of what the conversation should be is that would home health services through the VNH be appropriate for you based on what to expect after the procedure? If there's going to be mobility challenges, if there's going to be other physical limitations for an individual which again could create a taxing effort to get in and out of the house, then it would be very beneficial for a referral to be placed with the VNH. And so at that point, you just need to ask the primary care provider or the provider doing the procedure to submit a referral to us. Whether the procedure is tomorrow or it's 2 months from now, getting that information to the VNH sooner rather than later allows us to get a heads up of what to expect, what is coming down the pipe for services that are going to need to be provided to this individual. It allows us the opportunity to work the schedule, make sure that we're going to have the supports available during that time, and make it a very smooth transition from when the patient leaves the hospital to when our services come in. However, nothing would be finalized for our services, officially finalized for our services, until we have the discharge summary from the hospital. So that way we know specifically what supports are needed for that individual upon discharge. And again, just the sooner the better. It still allows us to get things set up. Again, prior to admission, please have conversations with your family and friends who may be able to provide some support to you. Our services work in cooperation with not only your primary care provider or the provider that's doing the procedure, but we also want to work with family and friends to ensure that there's a well-rounded support for everybody receiving our services, and understanding that we are not going to be in the home every single day. We traditionally are able to get into the home no later than 48 hours. Generally, it's the next day that we're able to come in and get things set up. But it's important to know that we're not going to be there immediately. We're not going to, be waiting for you when you get home from the hospital or anything like that. So, and also understanding that our supports, again, are not every day, and generally are about an hour every single day that we are there. At the beginning, we are there more often, a couple times a week, and then it kind of tapers off to once a week based on how the patient is doing. And again, everything that I'm saying is just a generalized understanding of what happens with our services. Every single individual services are going to be determined based on their needs. There may be situations where we might need to be in there, every single day. But in general, it's a couple times a week for the first couple of weeks, and then it tapers off to about once a week based on patients' needs. So once you are at the hospital and you are, you've had your procedure, everything went well. Now it's time to ensure that the next step in the process is ready. That VNH services are aware of you, that we know that you need those services. So ensuring that the referral has been placed to the VNH is very important. We need to make sure that we have all the best contact information for you, so that way we can reach out to you, your spouse, your friend, other family members, whomever it may be, whoever is going to be the person that we're going to need to speak to get things set up. Also, make sure that you're following up with your family and friends, that they know when you're going to be discharged. If they're a part of your treatment plan at that point, we'll be able to have everybody work together to ensure that the proper supports are set and ready for you. And again, like I had stated previously, we are not likely to be in your home on the same day, but we will be there within 48 hours. Generally, again, it's usually about 24 hours when we get to your home. And again, the earlier the referral is placed, the better, because then we can plan accordingly with on our end for schedules. Be ready for our phone call, so that way we can get that initial appointment set up. We are currently in the process of ensuring that we have one centralized number that you should be seeing on a caller ID. But currently, sometimes it comes up as an 888 number. Other times it comes up as an 802 number. So just the recommendation is just answer every phone call that comes through once you're discharged from the hospital, to make sure that we get a hold of you. But if we try to call you, we will leave a message. If we've been unable to reach you and we're playing phone tag, the phone number 888-300-8853 is the number to reach us, and we can get you connected to the scheduling team to set up that appointment. And we do everything possible to meet the needs of the individual based on schedule, based on what works best for other caregivers and things like that. But we always are greatly appreciative of any flexibility that is provided to get your services set up as quickly as possible. For the first visit, be prepared for it to be longer than other visits, specifically because there are assessments and additional paperwork that will need to be completed during that first visit. And is very important at all visits, but even most notably at the first visit, to ask a ton of questions. Ask what to expect during these services. Ask what should be done in between visits. Just be aware of everything, and don't feel like any question is stupid. We want to ensure that you have the best understanding, and that we've provided as much information to you as humanly possible, so that way you are for the services that you're going to receive from the VNH. In between visits from the VNH, always ensure that you are completing whatever has been asked by your therapy team, whether it's your skilled nurse, your PT, your OT, your speech therapist, whatever the case may be. Work on what they ask you to work on, and do it as it's been instructed, no more or no less. If you feel as though you could be doing more, then have that conversation with the individual that has assigned you the quote unquote homework, to explain that you feel like you could do more. The other piece of it too is that you can always call our triage team to ask if it's appropriate to be doing more to help with your recovery. And they're available to answer any of those immediate concerns. For any other questions or concerns that you may have that aren't urgent, just start a notepad with questions and be ready to ask once the individual comes into your home. Our services are available 24/7, and you will be given all the information of how to access the 24-hour services. But as always, if it is an actual medical emergency, please just dial 911, because that is the easiest and best way to get the supports that you need. Now, as we discussed, there are sometimes you go to the emergency room because you have something going on, and now we have an unplanned admission to the hospital. And again, when you get to the emergency room, obviously the number one concern is to get you stabilized and ensure that everything is okay. The next step should be to ask if home health supports would be appropriate based on what you're experiencing. Now, In several situations, I mean, you may be going into emergency surgery, you may be hospitalized because of something that's going on, so there may be some additional time. But even in the event that you go to the emergency room, they're able to, bandage you up in a couple of hours. It's still appropriate to ask about our home health services and if they would be appropriate for you. It's still the same process. There would still need to be a referral that is placed. And we just have to ensure that there is some sort of skilled need for the patient to initiate care, which, again, could be wound care, could be ensuring your safety around areas or activities of daily living, could be fall prevention. The list is long as far as what could be a reason why home health services would be appropriate to come in. And whether you speak with the doctor, a nurse, or a case manager or a care manager, somebody should be able to answer these questions for you and determine if supports are necessary or required or anything like that. And again, the worst case scenario is a referral gets placed, and based on our assessment, there may not be a need, but at least it doesn't hurt to see if the services could be available to you. And again, it's the same process like I've talked about before. If you were a planned admission into the hospital, it's just now it was an unplanned situation as to why you may need these services. And then the last of the three reasons that I had explained, in the event that you're visiting with your primary care provider or another specialist that you see, and it's determined that there may be, some supports in the home that would be beneficial for the individual, or you or one of your caregivers is speaking with the provider and says, A, B, and C, and it's kind of determined that maybe some home supports would be beneficial for you. In either event, your provider would need to to complete a referral to be sent to the VNH for everything to be reviewed and determine if the VNH services are appropriate. So again, in all three situations, a signed order from the doctor still needs to be placed for a referral to happen. But the three primary ways to get said supports in place would be a planned admission to the hospital, an unplanned arrival to a hospital, or just based on your routine appointments with your primary care provider or specialist, determining that the need may be there. And if there are any questions from any of the people that are viewing currently, I'm more than happy to answer those for you. I know a lot of times there are, as soon as the presentation's done, that's when all the questions happen. And with that, here at the last slide here, my contact information is available. Please don't hesitate to reach out if you happen to have any questions related to our services. And if I don't have the answer for you, I will ensure that I can get that answer for you. So it's not looking like there are currently any questions. So I do want to thank everybody who was watching this live. And I do thank everybody who watched it after the fact on demand on YouTube. Again, feel free to reach out if there are any questions regarding our services, how to get our services set up. And for everybody else, just so you're aware, on June 29th, which is 2 weeks from today, there is the information again on how to reach me. And for anybody else, you can just rewind the video at this point, and you'll be able to make sure that you get that information. So as I was saying, on June 29th at noon, I will be doing a presentation with Dr. Tawana from Mount Ascutney Hospital and Health Center regarding Alzheimer's disease. And I encourage everybody to join in and listen to that presentation. Sally, you're welcome for reposting the information on the screen there. And so on that note, again, I want to thank everybody for watching this presentation, and I hope to see a bunch of you at our presentation on the 29th. Have a great day.